Hello, class, and welcome to week 11. I hope you guys had a great weekend. You were able to enjoy the weather and your holidays. We are in week 11, which is April 13th through April 17th. So we are getting through this alternate learning style, and I hope these videos have been helping you. So we are going to go to the week 11 folder. So again, if you go to your weekly folders, you will see after you scroll down week 11, and you will see all the summary and all of the resources and any assignments that are due this week. So if we look at our week 11 summary, we are covering chapter 12 this week, and that is the topic of substance abuse. On Tuesday, the 14th, your chapter 12 reading assignment is due. And you can find that assignment if you scroll down here. So here's where you can submit your assignment. Here's the actual assignment, a reminder here of when it's due, and here you click here how you can submit it. So that is due on Tuesday. And on Thursday, as we finish up substance abuse, a participation assignment, the substance abuse reflection, is due. So if you scroll down, then you'll see the assignment here as well. Okay, so here's the instructions, and then you will click here to submit your assignment. But of course, if you're having any issues with that, you can always email me your assignments as well. Also in this week's folder, you will see numerous resources regarding the topic of substance abuse. You will see the website for Substance Abuse and Mental Health Services Administration, which is a very useful website about substance abuse, as well as trainings and advocacy efforts. I will also come back to these links regarding the Credentialed Alcoholism and Substance Abuse Counselor programs, or the CASAC requirements, as well as the specific training program that we have here at SUNY Orange. There's another document here that will supplement your knowledge about drug use and addiction. And then I've also shared the diagnostic criteria for substance use disorder as per the DSM, the Diagnostic and Statistical Manual of Disorders. And this is the most current according to the DSM-5, which is the most current. If you have any questions about anything related to week 11 or substance abuse, you can certainly post your questions there. And then I already showed you where those assignments are. So now we're going to start talking about substance abuse. So chapter 12 in our textbook covers the topic of substance abuse, as well as the roles of human service workers and social workers in regards to substance abuse, as well as the challenges that are faced and what social issues are being addressed regarding this topic. This is just a foundational understanding of substance abuse. As you continue your education, you will receive even more training and coursework regarding substance abuse. If you specifically want to go into this area of human services, then you will also be trained as a CASAC, whether you do it through a program or through your further studies. But in this field, you're going to experience in one way or another how substance abuse impacts a person's life, whether it's directly or indirectly. So I wanted to share some shocking statistics with you about drug and alcohol abuse. Those who abuse prescription opioids are 40% more likely to use heroin than those who don't. Prescription pill abuse is very, very common, unfortunately, and it puts an individual at risk for using more lethal types of drugs. The United States consumes 80% of the world's prescription painkiller supply, despite not even making up 5% of the world's population, which is rather a shocking statistic. Nearly 17 million adults in the United States suffer from alcoholism. An estimated 88,000 people die per year due to alcohol. And it's possible to die the first time that you use cocaine, and consumption quadruples the risk of sudden death. Another shocking statistic, long-term benzodiazepine users have an increased risk of developing Alzheimer's disease, which we read about in our chapter on gerontology. Drug abuse led to about 2.5 million emergency department visits in 2011, and my guess would be that that statistic might even be a little bit higher now with current statistics. Lastly, only about 11% of those addicted to drugs or alcohol in 2009 actually received treatment for their substance abuse disorder. So we'll talk a little bit about that as well. So those are just some statistics, but I'm sure just reading those or hearing those in this video hopefully makes you realize what a tremendous issue and social issue that this is in our country. So as I mentioned, all social workers or workers in the human service field deal with the consequences of substance abuse, again, whether it's directly or indirectly. And if you want to continue in this field, then you will, in one way, shape, or form, become a credentialed alcoholism and substance abuse counselor. And there are specific requirements for becoming a CASAC. And fortunately, we do have this program through our non-credit program. And this program is for you to be able to train, take the coursework, and also take the state exam, as well as the service hours that you would need to complete as well. So if we go back to the link in our Blackboard shell, then we can click on the requirements, which are state requirements. Oh, hold on. There we go. Okay, so you can see the New York State requirements to become a credentialed alcoholism and substance abuse counselor. So this website has really great information about the requirements, how to apply, and the exam that you will take. So if you are interested in this, definitely spend some time in that website and looking at some of the requirements and whether it's something that you definitely would like to pursue. And there are different colleges or organizations that offer the training program. And as I mentioned, we happen to have that program here at SUNY Orange. So if you click this link, you will be brought to our continuing and professional education, or CAPE, course offerings, and to the Credentialed Alcoholism and Substance Abuse Counselor Training Program. So it does go over some of the New York State OASIS, Office of Alcoholism and Substance Abuse Services requirements, and then it goes into the courses, how to register, special programs, and other information. So this is available for you in the Week 11 folder if you want to look into this a little bit more. Okay, so in terms of U.S. government drug classification system, back in the early 1970s, lawmakers developed a classification that was based on medical use and the potential for abuse. So I just did a little screenshot here. This can be found in your book. And your book also goes over the commonly used drugs and their effects, but you can see how drugs are classified in different schedules and based on their use and then a potential for abuse. So this is still used today. If we look at substance abuse and human development, there is a video for you to watch in the Blackboard course shell that discusses both dependence and addiction, as well as the psychological dependence and addiction, as well as the physical. When we are confronting substance abuse, it's important to address both the physical and the psychological. There are physical changes that take place in the body and the brain when someone introduces drugs and or alcohol into their system. And then there is the potential to develop a dependence, a tolerance, and an addiction physically. But also there is the psychological dependence and addiction that does occur as well. And it's important to address both of these in treatment because psychological dependence can be very strong. So please watch that video that is in Blackboard for you to understand these concepts a bit better. When we are looking at substance abuse and the causes of dependence and addiction, we need to look at it from a biopsychosocial model, or, as we've talked about, that person and environment model, where we're looking at all of the environmental, social, psychological, and biological, including genetic aspects of dependence and addiction. And the way that the problem is defined and assessed is critical, because then that will determine the interventions and the treatment that are necessary to help the individual recover. Your textbook guides you through the historical background of substance abuse treatment and prevention, and does a really nice job about all of the events or points in history that from back all the way back early, 1970s, the 1830s and 1840s, and how individuals viewed, substance abuse, and how religious groups found this to be very sinful, which led to the temperance movement, but then how prohibition changed certain things. So please make sure that you read through the historical context of substance abuse treatment and prevention, because it will help to understand the evolution and where we've come from, which is really from that medical or that disease model to a more strength perspective that is focused on recovery and focused on prevention. If we look at the current context, we have approximately 11,000 plus facilities and programs, but unfortunately, there still is a shortage, and there's often very long wait times for individuals to get into facilities or programs. And in these facilities and programs for substance abuse treatment and prevention, there's an interdisciplinary staff that includes social workers, case acts, psychiatrists, psychologists, physicians, nurses, peer counselors that all work together on a treatment plan for individuals. So also looking at more current context, as I mentioned, that there's a public policy statement by the NASW, the National Association of Social Workers, that say that the abuse of alcohol, tobacco, and illicit over-the-counter and prescription drugs is a significant health problem. So to address this, the focus is really on prevention and looking at the social, the economic, the environmental factors that are contributing to abuse problems. And in the context of the roles of social workers, the goal is, if we can focus on prevention and if we can empower individuals and communities and assist with economic development, it's believed that we can work on preventing these issues with communities and the individuals in the communities. So looking at more specifically the role of the social worker, AOD, or alcohol and other drug treatment interventions, are very individualized, and they address the associated medical, psychological, social, vocational, and legal problems, all the while emphasizing the foundations of the strengths perspective. So de-emphasizing problem areas, emphasizing client strengths, helping clients to confront the problem and break through any denial that may exist, They engage in case management, and they are driven by client-identified goals. Remember, that's that self-determination that is key. Drug treatment interventions are really critical. It can reduce drug use by 40 to 60%. And for every dollar that's invested in drug treatment, $7 are saved in health and social costs, because substance abuse does have tremendous health and social costs. So for every dollar that's invested, we save $7 in these health and social costs. I just felt the need to say that again. So the stages of treatment, as you read in your book, include stabilization, rehabilitation, and maintenance. So stabilization, typically this is when, the client might be forcefully confronted about addiction and their need for treatment. They are detoxing, they're abstaining from use of any substances, and here's where the commitment to overcome the addiction really needs to take place. Rehabilitation is when there is those intense therapeutic services. And usually the stabilization and rehabilitation piece is at least 3 months and could be a combination of inpatient and outpatient services. Maintenance is when you are engaging the client in therapy, skill building, and focusing on relapse prevention. So these services may include self-help groups, aversion therapy, social skills training. Cognitive behavioral therapy has proven to be very effective, along with other therapies for substance abuse. So in addition to these treatment interventions, social workers are also involved, and they're at the forefront of substance abuse prevention programs. They also advocate for more funding for prevention and treatment programs, and they evaluate programs for their effectiveness. There are a lot of diversity issues and populations that are at risk that social workers will also address, and values and ethics, as well as specific issues and concerns like alcohol and other drug issues in the workplace, drugs and HIV and AIDS, criminalization or treatment. Which do we do? Do we, criminalize these individuals, or do we provide them some sort of treatment, or both, which is one of the reasons why drug courts had come about. Other issues involve, performance enhancing drugs. So there's a lot of issues that social workers deal with in regards to substance abuse use, prevention, treatment, interventions. Prevention is better than a cure. Again, as I mentioned before, for every dollar that we put into prevention programs, we save the money that it costs us to rehabilitate and to treat individuals with these issues. So again, if you're interested in learning more about this, please look at the resources that are in Blackboard, ask me questions. I do realize that this was a longer video for you to watch, so thank you for bearing with me, and just make sure that you thoroughly read through this chapter so that you gain all the benefits of this knowledge. I also just want to send you some encouragement. Keep going. You've got this. I know this isn't easy. I know this isn't ideal, but you're going to get through this. We're all going to get through this, and we're going to come out hopefully stronger. We're going to come out, more resilient, and we just have to try to look at the positives. Okay, so I have something a little fun for you guys, because my kids have, at their school, they have, is it Joke Wednesday or? Yes. So, they've been really liking jokes. So we thought we would share this joke with you guys, and my daughter Kira, today she is going to say the joke, okay? Okay, so go ahead, Kira, go ahead and say it.
Where does the Easter Bunny like to eat out?
Okay, so where does the Easter Bunny like to eat out? If you email me your answer to this joke, then I will give you 5 bonus points on the assignment of your choice.